Every year, there are an average of 550 cases of pneumonia in children under 5 years of age that require hospitalization.
I couldn't believe it. I thought I was just brought him in because he was coughing, and I didn't know it was getting worse. He had strep pneumonia and the meningitis on his head.
Of those 550 children, 25 babies are like Joshua, with a very serious case of pneumococcal disease that requires long periods of hospitalization and ICU care. It is a life-threatening illness, and as in Joshua's case, a life-altering event.
He won't be able to move like before. He'll be very slow, and his hearing won't be that good. Like when I call him, he won't respond to me.
Future generations of Fiji babies will be protected against such a life-threatening condition with the arrival of 2 new vaccines into the country.
This is a great day for Fiji. These vaccines are going to change the lives of the children in this country. They'll prevent diseases like pneumonia and meningitis and septicemia or blood infections. Currently, those diseases are some of the most common reasons why Fijian children are admitted to hospital and die. So really it's going to transform paediatric care. Most children will get rotavirus under the age of 5. So this vaccine will again change what we see in paediatric departments and outpatients. It really should stop a lot of the diarrhoea admissions.
The magnitude and importance of vaccine-preventable disease is one of the main arguments used to justify the setting of national priorities. To get there, discussions, negotiations, meetings, and a lot of prayers have resulted in the birth of a new day in Fiji for our children.
The improved outcomes with these vaccines include the protection of our vulnerable children, parents who need to reduce their out-of-pocket expenses in healthcare-related activities, reduced inpatient time, and increased bed availability in hospitals so that nursing and medical time is focused on other pressing and important clinical issues. As a father of 3 grown-up children, a former obstetrician who has attended the funerals of children who I have delivered, children who have succumbed to diarrhea and pneumonic complications, I empathize with all grieving patients and parents. These vaccines gives me hope.
Today's handover will have lasting impact on generations of Fijians. For these 3 new vaccines, pneumococcal vaccine, rotavirus vaccine, and human papillomavirus, HPV vaccine, will ensure that Fiji's children are protected from pneumonia, diarrhoea, sepsis, and cervical cancer. It is, as Dr. Lisi said, a gift of life.
The introduction of these vaccines will take us many big steps towards completing the race towards MDG4 and MDG5. UNICEF as an agency that works closely with the government of Fiji and other Pacific Island countries, as well as with PIPS partners, Australia, New Zealand, JICA, CDC Atlanta, Rotary International, and the Secretariat of Pacific Community, along with our WHO colleagues here. We welcome this quality of expansion to childhood disease prevention. And we really thank you immensely for this contribution. I think the challenge for me and for the others is really how we can carefully document how this intervention will impact the burden of disease in Fiji so that we can be able to tell the story. The Australian High Commission has mentioned this is going to transform the landscape for many years to come. We need to document it carefully so that we can share with others, since Fiji is really on the cutting edge of this intervention. We congratulate the Ministry of Health and Australian government for this big initiative that will save a lot of lives.
Today also serves as an important milestone in the history of Australia's funding to Fiji's health sector, for it is in line with Australia's key aid priority, saving lives, for ultimately that is what aid is all about. The Australian Government, through Australian Aid, is extremely proud to be supporting this program through an investment of over $10 million for the next 4 years. And both the Australian Government and on a more personal level, my staff and myself congratulate the Ministry of Health for driving this process, with the ultimate aim of bettering the lives of children in Fiji. Under this program, over the next 4 years, the Ministry of Health will aim to immunise 22,000 babies per year with the pneumococcal and rotavirus vaccines starting in September 2012. The legacy of this initiative will last long after we at the High Commission have moved on, and long after the health professionals here have retired. And that is an achievement to be proud of.
That's the best part of it. I don't want children to get sick. I mean, really sick and come here. They can get sick, but not this sick. So I'm glad if intensive care is going to be quiet. There's no children here. I'm gonna think that all the service, all the vaccines, all the thing is helping them. So I'm happy if it's empty.